During the Renaissance period, the appearance and maintenance of hair among common people were influenced not only by fashion, but also by practical concerns, hygiene practices, and the accessibility of grooming tools and remedies. Unlike the aristocracy, whose grooming habits could be elaborate and were often supported by specialized servants or barbers, commoners managed hair care with simpler means, relying largely on home-based solutions and basic implements. Understanding this aspect of everyday life offers valuable insight into how Renaissance society balanced aesthetics, health, and social status. One of the persistent challenges in Renaissance hair care, especially among common folk, was the prevalence of lice infestations. Lice were a widespread issue due to crowded living conditions, infrequent washing, and the sharing of bedding and head coverings. To combat this, lice combs were essential tools. These combs were finely crafted with tightly spaced metal or hard wooden teeth, designed specifically to catch and remove lice and their eggs from the hair. Archaeological finds and museum collections often reveal such lice combs, which were sometimes simple but well-made items, reflecting the importance of hair hygiene. Common lice combs were usually small and portable, making them accessible for daily use at home. The process of lice removal was laborious and uncomfortable but necessary, as infestations could cause significant itching, skin irritation, and secondary infections. Lice combs often had handles carved from bone, wood, or occasionally metal, allowing users to grip them firmly while working through the hair. The fine teeth had to be carefully designed, close enough together to trap lice and nits, yet sturdy enough to avoid breaking. This level of craftsmanship indicates how essential lice combs were for maintaining hair health and personal comfort among commoners. Removal of lice was frequently accompanied by manual picking and cleaning the scalp, which further demonstrates the hands-on approach to hair care in this period. Families would gather to comb each other's hair, creating a communal grooming ritual that also reinforced social bonds. Despite such efforts, lice were stubborn pests, and their eradication was a continuous task. Greasy hair was another characteristic of Renaissance hair care challenges, especially for those commoners who bathed infrequently. During this era, daily bathing was not the norm, partly due to cultural attitudes toward water, limited access to clean water, and the belief that too frequent washing could damage the skin and body's natural balance. However, the accumulation of sebum, sweat, dirt, and dust often left hair feeling oily and weighed down. Greasy hair was therefore common, and commoners developed practical methods to manage this condition without frequent washing. Instead of using sophisticated shampoos, common people relied on rinsing the hair with simple, home-prepared solutions, often derived from everyday kitchen ingredients. For example, vinegar played a significant role in hair care for its cleansing and dulling properties. Vinegar used as a rinse helped to remove the oily residue, restore shine, and reduce scalp irritation. This practice was grounded in the mildly acidic nature of vinegar, which could help balance the scalp's pH and deter lice, while also imparting a fresh scent. In many households, vinegar was diluted and applied after a basic wash with water or herbal infusions. In some cases, it was combined with other natural substances like rosemary, lavender, or sage, which were believed to have health-promoting effects and pleasant fragrances. Using vinegar not only helped in cleansing, but also contributed to a perception of cleanliness and vitality, important for social interactions and work where personal grooming affected one's reputation. In addition to vinegar, other home remedies involved the use of ash, particularly wood ash from hearth fires. Ash was a readily available substance that contained alkaline components, which could act as a mild cleanser and detergent. Commoners sometimes mixed ash with water to create a scrubbing paste, or used it as a dry powder to remove excess oils and dirt from the hair and scalp. This technique was rougher than modern shampoos, but served a similar purpose, absorbing grease and helping to cleanse hair between washes. Ash was also thought to have insect repellent properties, providing a secondary benefit of discouraging lice and other pests. Again, This reflects the practical combination of everyday materials with observations about their efficacy, forming the basis of folk hair care traditions passed down through generations. While these methods may seem rudimentary by modern standards, they addressed the real challenges of hair hygiene in a period without widely available soap or commercial cosmetics. The combination of lice combs for mechanical removal, vinegar rinses for cleansing and scalp health, and ash for grease control demonstrates how Renaissance commoners adapted their grooming routines to their environment, resources, and social realities. These practices highlight a resourcefulness that bridged hygiene, health, and modest ideals of appearance, allowing non-elite populations to maintain acceptable standards of grooming despite limited wealth and facilities. The management of hair was intertwined with social expectations and cultural beliefs. Cleanliness was not only a practical concern, but also linked to moral character and social acceptance. In many towns and villages, visible neglect of personal hygiene could lead to social stigma or assumptions about an individual's honesty or work ethic. Thus, even though commoners had fewer luxuries, they valued hair care and used the tools and remedies at hand to present themselves with dignity. Moreover, home remedies like vinegar and ash also reflect an early form of chemical understanding, albeit empirical, within a domestic setting. Throughout the Renaissance, interest in natural philosophy and medicine increased, leading to wider circulation of herbal knowledge and recipes for health and beauty. While much of this was documented in manuscripts or printed herbals accessible mainly to literate elites or physicians, practical knowledge often permeated through oral transmission among common folk. In towns and smaller settlements, barbers occasionally offered their services not only for hair cutting, but also for scalp treatments and hair washing using herbal preparations. These early barbers sometimes functioned as midwives, surgeons, and purveyors of remedies, bridging the gap between official medicine and popular cures. However, for the majority of commoners, home hair care remained a personal or domestic responsibility, with vinegar rinses and occasional lice combing being the main strategies to manage hair hygiene. The textures and hairstyles themselves for commoners were typically modest and practical. Men often cut their hair short for ease of maintenance, while women might wear their hair pinned back or braided to keep it tidy during work. These styles minimized exposure to dirt and pests. The application of ointments or pomades made from natural fats or beeswax was less common among commoners than aristocrats, partly due to cost and partly because such products could exacerbate greasiness and attract more lice. The restrained, pragmatic approach to hair care and styling among the lower classes of the Renaissance period contrasts sharply with the elaborate coiffures and powdered wigs that emerged later among the upper classes. Yet these everyday practices reveal much about the intersection of health, culture, and material conditions for the majority of the population at a time of dynamic social and technological change. In summary, managing lice, greasy hair, and the search for effective home remedies were crucial elements of Renaissance hair care for commoners. Lice combs were indispensable tools for mechanical pest removal. Vinegar rinses offered a natural cleansing agent to combat oiliness and improve scalp health. Ash, a ubiquitous substance in every household, served as a rudimentary detergent and pest deterrent. Together, these methods, rooted in observation, community knowledge, and resourcefulness, sustained the everyday hygiene practices that shaped the appearance and well-being of Renaissance common people.